Welcome to the February Fire Chiefs video message. This month I have Pete Perringer back with me here in the studio. Welcome, Pete. Thanks
Chief,
for joining me.
Glad to be here, thanks.
One of the things that is always challenging and always difficult is loss of loved ones, loss of co-workers, and the tragic events just earlier this week, as we've identified it, and you communicate a loss of a champion. The sudden and tragic passing of Emily Crown a couple of days ago was and will be impactful for many. It's amazing when you go back and look at Emily's role, activities, her influence. Just yesterday we had our briefing, quarterly briefings, and she had already prepared her information for that. And just last year there was over 4,000 contacts in the car seat and child outreach components through Safe Kids. And as we've talked about, it's just so amazing. What do you have information on how Emily's contacts and impact has been?
Well, you mentioned it's far-reaching, many tentacles, and over 30 years of her involvement in child safety advocate. She's really had an impact on the community very quietly, and even to making sure that the car seats are in every single EMS unit in Montgomery County. But her work with Safe Kids, not only in Maryland but worldwide, and of course in Montgomery County. She started in consumer affairs.
Yep, OCP.
And then transitioned over into fire and rescue. I think it was 2000 or somewhere around there. And so since then, there were years where we did 10,000 seats. They did 10,000 seats a year, and we've evolved where we have a child inspection station, old Station 25 there, Connecticut and Georgia Avenue, and her work and just with the folks at the very basic needs of helping people get the child seats. So it's just been far-reaching, and in fact, she had a international trip planned in a week or two for car safety advocates. So she's impacted legislation in Maryland and in the country, and it's just had an impact. It's going to be a huge loss, but she's certainly left a huge legacy.
And as you articulate, as a member of the National Highway Transportation Safety Administration, occupant protection and child assessments, the National Child Passenger Safety Board, being a consultant or an advisor to the major car seat manufacturers, as she has over the years. And she sat in this chair and back in October of 2015, and as she always does, she beamed about the information, and when you walk by that part of the office, there's success stories, and there will continue to be success stories from parents who report that their child, their grandchild was and is safe based upon the safety provided by a car seat provided to them or installed correctly by one of the nearly 80 folks that are car seat technicians underneath Emily's program that do over 500 or 600 car seats checked each year, and the contacts. And there was just an event this weekend where she was out doing car seat checks, and she's, as you said, had an upcoming trip, but was recently, as we communicated, awarded the Barbara Foley Quality, Safety, and Injury Prevention Award, by the Emergency Nurses Association, as a nationally recognized, individual for her innovation and dedication to, advocacy for the safety of children, Safe Kids. It's huge loss, and something that we will all collectively, as a fire department family, work together to support the Crown family, Monty and Chris, as well as the other members of the Crown family, to process through and to honor and remember Emily's role and commitment to child passenger safety. So thoughts go out to Monty, Chris, and the entire Crown family as this difficult time and moment.
Well, I think it gives us an opportunity to redouble our efforts and continue our legacy of child safety advocacy, and I think we're well positioned to do that with the Crown family's help going forward. I think we will continue to be a leader in the country in that regard. Thanks a lot because of the foundation that Emily has established for us.
Right. Yep. One of the things about preparedness and readiness rolls into, February. February is referred to as Heart Health Month.
Mm-hmm.
Tell me some of the things that are ongoing related to the topic of February.
Well, other than the fact you made me walk up the stairs to get to the studio here today, that was a good start, so I thank you for that. But Heart Health Month, typically it's Valentine's Day, so it's a good time to remind us that how important heart health is. And one thing it's very easy to do now is learn CPR. It's hands-only CPR. You can really learn it and learn how to save a life with just your hands, and take about 15 minutes or so. So, focus on that a little bit. But, in the recent past, we've had a number of cases in Montgomery County and throughout the region, in fact, where people have been saved by bystander CPR and the quick access of the AED and the 911 and getting to the hospital. So it's that chain of survival. So it's a good time of year to focus on that. It's usually, cold winter months, and we're looking for something to do. So learn CPR. We've had a number of cases which we'll highlight soon with a recognition of bringing some victims and rescuers together here in the next coming weeks. But there's been a number of people that are walking around today because somebody took the effort to get involved and save their life.
And that is tied in with high performance CPR and the skills there. The number was presented just recently. The save rate is in the 34-38%, I believe,
right,
over the last quarter. As was highlighted, that used to be 10% was phenomenal as a community save rate or resuscitation rate, and we have mid to upper 30s, and that goes directly to the folks that start that chain, the bystanders, followed through the 911 operators, anybody who has the ability to access and utilize a public access AED, and then the responders and the EMS section for really advocating the HPCPR and getting that out there through the initial trials we did and then protocol adjustments. So it's making a great and huge difference. And the event you're referring to was electrocution, which created a survivable chain, and that gentleman is thankful for that for the day. So good point about Heart Health February, but there's always needs to be, and just a couple weeks ago we had another event which proved and demonstrated the value of the very simple safety tool in our house, that smoke detector. We have an upcoming joint event with Prince George's County and PEPCO. PEPCO has been an excellent supporter of the home safety activities and providing smoke detectors to public safety agencies. And we had a house fire in Station 9's area that the residents, or more specifically the relatives of the resident in question, directly attributed their family members' ability to get out of the house to the work of the community outreach section. Jim Resnick, some folks from Aging and Disability, as well as Station 9 folks had been out, had installed smoke detectors in the residence, and while the exact cause of the fire is still undetermined, the resident reported being awoken by the smoke detector and was able to exit that structure. Company 9 arrives, house is fully involved, and remains only standing 3 brick walls, after an aggressive firefight. The resident was unsafe outside of the structure and can attribute that to the early detection of a smoke detector. And not enough can be said about the smoke detector's presence, the ability to get that early warning for our residents to know to get out, call 911 from the outside, and let the situation be handled by the responding fire rescue personnel.
Yeah, and that was one of the most dramatic situations that illustrates how important smoke alarms are. But if you think about how we got to that point, where we have our community outreach, getting together with social services. Social services had recently been given some advice and guidelines as far as interaction with fire rescue and community outreach. They took us up on that. They went out and visited this home for a variety of reasons. They installed smoke alarms. They talked to the people about the safety, and they were able to leave that home a little better off. But there was still a little gap in the protection there because they couldn't get access to that one resident who was living downstairs for a variety of reasons. Yep. And the Station 9 crew went back, I think it was on an EMS call possibly, but they had instances to be back in that home, and they recognized the fact that the lower level was not protected by smoke alarms, and they were able to actually install the smoke alarms, and now you know the rest of the story. So I can tell you though, my experience has been recently is, which hasn't always been the case, is most of the time I get on these fires and I go to the big ones, is that people have been alerted by smoke alarms and they get out. And it used to be, and we all know that that wasn't the case. It was always the smoke alarm didn't work or whatever. And but the good news is the alarms are working, people are getting out and calling 911 safely from outside. So as we count down to 2018 and the new law meaning the 10-year smoke alarms are required, and that's what the home in Hyattstown had installed, in fact. We are going to continue to save lives in that area.
And you dovetailed that into the partnership between Health and Human Services and Fire Rescue, and Dr. Stone and Lieutenant Baltrowski were recently recognized for the abstract presentation that they did on the evaluation of and the ability to mitigate and lower the frequency of people calling 911 for services by engaging HHS resources and fire rescue resources to support these customers and residents with additional capacity. This award was the National Association of Emergency Physicians abstract presentation that Roger received just a couple weeks ago. And that again highlights the fact that so many things are ongoing outside of the actual response to an emergency that support the community. Our providers that go to an event, you got that patient that has frequent needs, you've been to a couple times, there's that check button in the patient care report that gets pushed directly to the folks in EMS. They review those, they meet on a monthly basis with Health and Human Services, and they work to provide additional capacity or resources and services to those residents so that they are not totally relying upon 911 as their safety net, and they have additional capacity. And that program has worked. It's been very successful. HHS is working for a funding opportunity to put a full-time person into that to provide support to that. And that will continue incrementally to add customer support to the residents so that they are the benefits of the great capabilities of Montgomery County. They just may not be aware of them, or they may not have the knowledge that they need to reach out for this or that.
So and what we're talking about is a community medicine, our version of community medicine. And as you alluded to, they've been working with our EMS folks have been working with HHS for quite a while on this. And most of us know them as frequent flyers or super users. We have been working with, and I think have made significant progress. The numbers are just mind-blowing as the progress they've made with these vulnerable groups of people. So good work there. There's a Washington Post article recently about what's going on in that area in this region, and so Montgomery County has I think a unique perspective on that and has been working very hard in that area. So congratulations to Dr. Stone and the EMS crew for their presentation.
Excellent work, and it's progressive and forward thinking that starts many months and years ahead of time, that then works through and gets a program together like that turns benefits and makes success stories.
Well, just with the 2016 coming to an end, I was looking at some statistics as far as our number of calls. We're up a little bit as far as the number of responses, but 220,000 unit responses on 120,000 calls or so, 91,000 EMS calls. So we have plenty of opportunity to interact with the community and look for these folks. So.
You know, as these charts pop on the screen while we're talking about it, you know, stations 8 and 25, almost 10,000 calls. You know, in the 9,000 calls each, the demand for service in their response area. Those numbers are staggering.
Yeah.
The fact that, as an example, Station 8's engine company response is over 4,000 calls now. And we have many engine companies that are well above 3,000 calls. EMS units, 3,500 calls for one EMS unit at a station. You know, that is a thing that we're focusing on. That's why part of our push is more EMS capacity. And there's no doubt, as we've said to the troops, you come to work and you stay busy. You know, the time that used to be downtime or, you know, uncommitted time, that doesn't exist in a lot of the work sites. They're running 30 or 40 incidences in that station area a day. You know, Station 8, a 30 call day is a slow day, you know, and that's very much an impact on the community and an impact on the personnel that work there. So my hat's off and my thanks and appreciation to all the folks at all the stations and how we are able to address that. So yeah, it went up by about 3.25% over the year before.
Right.
Call volume's going to go up, population's going up, the demand for services are going up, the demands are getting different. So a lot of things in that line, and we're working through things. But again, there's a lot of new stuff also ongoing as we talk about apparatus, as we talk about equipment. Things have to adjust and change. The engine committee is quite busy. They're reviewing the tanker bids that came in for 2 new tankers. They will then shortly right after that review the bids for the roughly 4 all-wheel drive engines. And the bids have been received back for the 25 engine companies. So in the next 30 to 60 days, they will have reviewed all of those, made recommendations to me, and we'll have awards going out to engine companies or apparatus manufacturers for 2 tankers, all-wheel drive engines, as well as engine companies. But another dozen ambulances are on order. The first tiller truck from Spartan is back after having the modifications made from the engineering issues that were discovered. Everybody was pleased with what was done. The second one's in the process now, but so that those hurdles are being overcome, and those 3 TDAs will be you know, bolstering the truck fleet back up.
Well, I think one of the most important additions to the fleet has been the new PIO vehicle. So thank you very much for that. Long overdue, but very much appreciated. So coming to a fire or incident near you, the new PIO vehicle. So thanks. But there's been a lot of additions to staff vehicles and EMS, as you already mentioned. And
we're talking about new apparatus, but there's a lot of new portable equipment that's rolling out. New SCBAs, a little over 1,000 new SCBAs are sitting at South Lawn. A couple of them, 2 per station, will be arriving very soon at the station level. The annual research are ongoing, which includes information about the new SCBA. It's very positive that it's still a Scott product, so the new parts are limited, but there's a lot of unique features to the 5.5 X3 versus the 4.5 systems. A lot of safety benefits, as well as ability to communicate more effectively. They have that pack tracker or that locating beacon built into them. So new equipment, it's anticipated, and the rollout plan is the middle of April, the week of April, I believe it's 17th, is the time frame where we'll be switching all units over from the old SCBA to the new SCBA in about a 4-day time frame. And the training will be completed by then. So those packs are coming out to the stations for in-station familiarization. There will be an in-station training session, hands-on skills checkoff, being coordinated by the academy, because the SCBA is the most critical piece of our protective equipment. We got to wear our turnout gear, and then we got to wear our SCBA, and clearly we have to have the confidence and the ability to know how to grab the dual EBS down here on your right hip versus what used to be on your right shoulder, and all those different things, and how critical that is. So new SCBA is a big thing. It's been being worked on for a while. Very much appreciate the about $9 million of support from council to roll with a new little over 1,000 SCBAs. Right behind that, sometime in the late spring, early summertime, will be new gas meters. I will use the word 3 gas meters, so it's a new handheld multi-gas meter, as well as gas tracks. Gas tracks, or the old Sensit devices, will be coming back because the new meter doesn't have the PPM technology or the PPM mode like the old ones did. So those meters have served us for another good time, almost about a decade. And we have come accustomed to every unit having a multi-gas meter, every unit having the ability to check for things. So good work by the meter shop through technical operations at logistics to get those meters coming out, as well as new rad meters. So a lot of new equipment coming out with some of these new apparatuses as well.
I know you touched on training a little bit, but I've had an opportunity to stop by, as you have as well, the training academy. Of course, you had Chief Clements in here recently talking about the facility, but it's just been crazy busy there. Maybe not crazy busy, but a lot going on training-wise. Any updates on level of activity at the training academy?
So in-service is actually going to be at the training academy this cycle. One of the things is we want to get people exposed to the training academy and the capabilities of the academy. It's going to be a combination of the burn building or the flame master system, but as well as a water supply issue, because now we also have the water supply cistern, the drafting tank, and that activity. So they're building a scenario that combines both, and training in service will be at the academy in the upcoming cycle. Plenty of things going on. There was 2 police academies and 1 fire academy class ongoing at the same time for a couple weeks there at the end of January, before recruit session 63 from the county police graduated just the other day. Plenty of things going on, and I sure hope to have class 42 in there in the September-October timeframe as well, to continue on with the recruit factory, as we name it.
Okay, you heard it here. Class 42 coming up in the fall, so we're looking forward to that. Anything else new that we need to talk about?
Always plenty of things new. I think that's a good summary for today. Again, it's still February. At the moment, it's beautiful. I think tomorrow it's supposed to snow. That's just crazy in upon itself. As we talk about this being annual research time of the year, we got to make sure we get those trainings done. We have to make sure we're up to par on that. One of those is CPR. One of those is AED, SCBA. Bloodborne pathogens, the things to protect us from the daily activities that we get interfaced with. Right after that, as we've talked about, the new CAD training is out. That'll actually roll into place in about a month, March 13th, I think that is. That's going to turn live, so Premier 1 CAD will be on, and fire station alerting through Purvis will be online. So that's a big process that Stacy Daniels, John Kinsley, and a bunch of others have worked quite a long time on now, and that will we'll see an impact there. So till next month, when we'll have more new stuff, but that's a part of technology and business today, is a lot of new things coming to keep us fresh and to keep things rolling along.
Yep, but you mentioned tomorrow. Of course, it might not be tomorrow when the folks see this, but there has been a roller coaster of weather as we speak. It's been 67, close to 70 degrees. Tomorrow it's going to snow. So we've seen that up and down weather. So that's that time of the year. Just everybody be ready to respond to whatever might come around.
And tragically, we've seen the repetitive but also preventable ash fires. We've seen some tragic incidences this winter season from fireplace ashes, which we know can be prevented, which we just have to keep pushing the fact of how to put those things in a sealed metal can and get those things away from the structure. Don't burn your papers in a metal pan and then put it on the shelf. Don't put it in a paper bag and put it on top of the trash can. Many other ways to do that, so definitely a lot.
And we know the simplest thing you can do is just make sure you have a working smoke alarm, so I'll give you the last word.
No. It's definitely February. As we say, the weather's fluctuating rapidly and extreme changes of weather. Again, take care of those research, get that training done, be ready for the next call, be ready to jump out there when the weather really does break and get good to work on skills as we talk about the ability to take your basic skills, put them together, make building blocks out of it, and be prepared for that abnormal or the once in a lifetime call. Till next month, take care.